Teeth are just like any other part of our bodies and can get hurt just like our muscles or bones. Hi, I'm Dr. Hatamian, and we're here today to talk about some of the most common dental emergencies. Some of the most common dental emergencies that we treat are chipped, fractured, or crooked teeth, lost fillings in the front teeth, toothaches, broken ortho wire, compromised aesthetics for the front teeth, and the discomfort from the jaw pain. The common cause of chipping or fracturing teeth is obviously trauma. The trauma could be a minor trauma from biting on a utensil like fork or biting into a sharp object or food, or it could be as a result of an accident like falling off or hitting the pavement, or just simply could be a tooth decay under an old filling. We usually treat a chip or fractured tooth, depending on the case, by a restorative procedure which could involve bonding composite resin to restore the aesthetic of the tooth. And sometimes, again, depending on the case, the tooth might require a crown or some sort of extra coronal restoration. The healing process after the treatment has been completed is very quick. It could be a few hours to even a few days. Some people might experience some sensitivity to cold and hot and chewing for a little while, but it's usually pretty quick, especially if the patient is younger. After the treatment process, we recommend to the patient not to use a damaged teeth for a day or two. Avoid chewing on that side and until it's completely and nicely integrated with the natural teeth. The most common cause of losing an old filling is a cavity underneath the old filling. The other cause of losing an old filling could be from biting into some food or object that will cause the filling to come out. The treatments that we offer for fillings that are falling out is mainly to remove the cavity under the old filling and then restore the filling to its original shape and size. So what we recommend to relieve the sensitivity to temperature is, the most common one is to using a desensitizing toothpaste such as Sensodyne or Colgate Sensitive, and they would just brush their teeth, especially in the area of sensitivity, with that particular toothpaste 1 or 2 times a day. One of the causes of toothache is a cavity. Cavities are infections. They should cause damage to the nerve inside the tooth, and that would lead to pain. The other cause of a toothache could be an infection or abscess inside the jawbone, which could put pressure on the tissues around the tooth, and that could be interpreted as pain. Some people take some over-the-counter medications such as Advil, Tylenol, or use some topical anesthetics like Orajel, apply it around the sensitive area in the mouth, or just simply rinse with salt water. So the treatments for toothache really depend on the etiology or the cause of toothache. So first we need to establish a clear diagnosis. Once we have a diagnosis, then we can discuss the treatment options, which could include replacing an old filling, doing a root canal, or just extracting or pulling the tooth. So a fixed orthodontic retainer or a fixed wire is a little wire that's cemented or bonded behind the bottom teeth or up behind the upper teeth to retain the teeth in place. The temporary measure, or if the orthodontic wire is broken, normally sometimes they have like sharp edges. I've heard some people using maybe a piece of gum. It's not really the best option, but it could relieve the sensitivity of their tongue coming in contact with the broken wire until they can see the dentist and get it fixed. To treat a broken orthodontic wire, we can either cut the entire wire out and re-cement a full wire back in, or most of the times it's a matter of rebonding or reattaching the broken part back on the tooth. One of the most common causes of dental emergencies is a jaw pain and the discomfort from jaw pain. Some of the most common causes of jaw pain is from daytime clenching and/or overnight grinding of your teeth. Some people have the habits of chewing on hard food or even chewing gums. The common treatments we recommend for jaw pain is stress management, practicing yoga and meditation, avoid chewing hard foods, and also we recommend a custom fit night guard, which is done at the office.